What's up, guys? In this video, I wanted to answer a question that gets asked quite a bit actually, and that is, what is a normal blood pressure? Let's say you go to your doctor's office and they check your blood pressure and it's 124/82. Now, patients will ask me, is that good? Is that bad? What do we do with these numbers? So I wanted to break that down a little bit as far as what your doctor or provider might be thinking when they see a certain blood pressure number. In 2017, the guidelines changed a little bit as far as the management and definition of high blood pressure. A normal blood pressure is now defined as less than 120/80. Now, anything above this number, we need to start thinking about healthy lifestyle modifications and possibly medication depending on how high the blood pressure is and the patient's medical history and risk factors. The reason for the change in the blood pressure management is based on a large trial that showed significant reductions in the risk of having a heart attack, stroke, and death from all causes when blood pressure was less than 120/80. Now, these new guidelines placed a strong emphasis on healthy lifestyle modifications, things like proper diet, exercise and weight loss, stopping smoking, and cutting back on excessive alcohol use. Now, this is fantastic because many people can significantly improve their blood pressure through natural methods alone and prevent the need for having to start a blood pressure medication in the first place. And many people that are on blood pressure medication can improve their blood pressure through natural methods as well, and maybe either stop their medication altogether or decrease the dose or get off one of their medications through those methods like diet and exercise and some weight loss and those types of things. Now, your doctor is also going to take into account your medical history and risk factors. There are risk calculators that give us an approximation of what your risk of having a heart attack or stroke is in the next 10 years. And if this number is greater than 10%, or if you already have known cardiovascular disease, or you're diabetic, or you have some kidney disease, then we're going to need to treat the blood pressure a little bit more aggressively and consider starting a blood pressure medication. So if we go back to the patient that had a blood pressure of 124/82, at this point, your doctor is very likely just to recommend healthy lifestyle modifications and will continue to monitor the blood pressure over the next 3 to 6 months. I hope this helps describe what normal blood pressure is and how we manage this. For tips on how to lower your blood pressure naturally, check out my other videos and check out my free book, 10 Superfoods to Lower Blood Pressure Naturally. We'll see you in the next video.